Your doctor has recommended that you have a radical mastectomy. But what does that actually mean? Radical mastectomy is the removal of the breast and surrounding tissue. In most cases, mastectomy is required in order to remove cancerous tissue from the body. The extent of tissue removed is determined by the amount of cancer present in your body. A radical mastectomy is the most extensive form of breast cancer surgery. It calls for the complete removal not only of the breast, but also of the lymph nodes, as well as part or possibly all of the chest muscle that lies underneath the breast. Lymph nodes are small junctions that join the vessels that make up the lymphatic system. The lymphatic system circulates a bodily fluid called lymph, in the same way that the circulatory system carries blood. Your doctor has recommended that you undergo a radical mastectomy because the cancer in your breast may have begun to move into the lymph nodes under your arm, as well as into your chest muscle. This procedure may result in the loss of some muscle strength in the arm on the affected side of the body, and will permanently change the outward shape and appearance of your chest. So make sure that you ask your doctor to carefully explain the reasons behind this recommendation. In the case of mastectomy as a treatment for cancer, the only real alternatives to surgery are radiation therapy and chemotherapy. But because breast cancer is so potentially dangerous, most patients who undergo mastectomy also receive radiation therapy, chemotherapy, or both. In any case, your doctor has recommended this procedure because he or she believes that surgery is in your best interest and may even be vital to your survival. Choosing not to have this surgery could put your health and life at grave risk. You must make sure to talk to your doctor about all of your concerns before making a decision. But as with all cancer treatments, a decision to act should be made as soon as possible. On the day of your operation, you will be asked to put on a surgical gown. You may receive a sedative by mouth, and an intravenous line may be put in. You will then be transferred to the operating table. In the operating room, the anesthesiologist will begin to administer anesthesia, most probably general anesthesia by injection and inhalation mask. The surgeon will then apply an antiseptic solution to the skin and place a sterile drape around the operative site. Two incisions will be made, beginning at the middle of the chest, one along the top and one along the bottom of the breast, coming together just under the arm. The skin is then lifted up and away, revealing the tissue underneath. Beginning at the clavicle, or collarbone, the surgeon then begins to carefully cut the breast tissue away from the muscles that lie just beneath. When the breast has been completely freed, it is lifted away, exposing the top layer of muscle called the pectoralis major. Your doctor will remove this muscle. Below the pectoralis major lies another chest muscle called the pectoralis minor. This muscle will also be removed, fully exposing the fatty tissues that lie beneath it. Within this fat deposit lies lymph nodes, lymph vessels, blood vessels, and nerves. Using great care not to damage the large thoracic nerve, your doctor will remove the lymph nodes and surrounding fat. Blood vessels will be tied off, and your doctor will thoroughly examine the surrounding tissues for any other signs of disease. When the surgical team is satisfied that they have done all that they can to remove the cancer, they will release the muscles and other tissue. One or more drainage tubes will be temporarily inserted at the site while the healing process begins. They will then close the incision. Finally, a sterile bandage is applied. Most patients experience at least some pain following surgery, but if properly handled, it shouldn't present any serious problems. Pain used to be regarded as an unavoidable side effect of surgery, but today, pain can be managed with great effectiveness. And as the patient, you have an important role to play. Before surgery, be sure to ask the medical staff about the type and duration of pain normally associated with your surgery. Find out in advance about your pain management options. Work with the staff to develop a pain management plan. Discuss your options. There are alternatives to drugs that can lessen your need for pain medication. Ask your doctor for help in finding a pain management class. Many of these workshops teach helpful relaxation techniques, positive thinking, and nerve stimulation exercises. Following surgery, make sure to let your nurse know right away how you're feeling and whether or not you are in any pain. Be specific and help them to measure your discomfort. If you're having trouble expressing yourself, try to rank what you're feeling on a scale from 1 to 10. Never be shy about asking for help. If you experience pain that just won't go away, report it to the nurse. Pain is an important indicator that helps you and your medical staff understand your body's healing process. Following surgery, you should expect to feel soreness and muscular weakness in your chest area. Because the chest muscles that lie beneath the breast have been removed, some of this weakness will be permanent. But perhaps the most profound after effect of the mastectomy is often not physical, but psychological. Adjusting to such a dramatic change to the shape of your body may be difficult. You should expect to experience a wide range of emotions, and certainly your doctor will probably encourage you to share your feelings with a qualified therapist, someone who can help you through this transition. The surgery itself only rarely leads to complications. One potential complication is a persistent residual neuralgia, or pain around the scar. It can be either localized or general. It may develop soon after surgery or even weeks or months later. A more serious complication comes from accidental damage to the nerves in the chest cavity. Germs are present always on your hands, and they can be transferred to other parts of your own body, to the family member for whom you're caring, your patient, and to any clean object you touch. By washing your hands correctly, you remove germs from your hands. Hand washing is the single most important way you can prevent infection from occurring and prevent the spread of infection. You You must carefully wash and dry your hands before and after each time you care for your family member, your patient. Before and after you handle your patient and your own food and drink. Before and after you manipulate any contact lenses. Before you apply and after you remove gloves. After you use the toilet. After you cough, sneeze, or blow your nose. After contact with anything that could be soiled or have germs on it. After you pick up any object from the floor. Hand washing takes a minimum of 10 to 15 seconds, longer if your hands are soiled. The longer you wash, the more germs are removed. The friction generated by rubbing your hands together removes the germs from your skin, and running water can then wash them away. Every time you wash your hands, take your time and don't rush. Do the hand washing carefully and thoroughly. Use liquid soap from a dispenser. Bar soap holds germs on its surface. Make sure you have paper towels and a waste receptacle nearby. Remove all jewelry from your hand except a wedding band, and push your watch and sleeves up away from your hands. Turn on warm water. Point your fingers down to prevent water running onto your arms and wet your hands. Apply soap from the dispenser. Point your fingers down and rub your hands vigorously together in a circular motion. Start counting seconds at this point. Intertwine your fingers to clean all surfaces of the fingers. Rub your fingernails against the palm of the other hand to get soap under the tips of the nails. If your nails are soiled, clean under them with an orange stick or brush. Keep your hands down and continue to rub them together in a circular motion until the end of your count for 15 seconds. Keep your hands down and rinse them from the wrist to fingertips. Pick up a clean paper towel and turn off the water, still keeping your hands pointed down. Discard the paper towel into the waste receptacle. Pick up another clean paper towel and carefully and completely dry your hands. Discard the paper towel into a waste receptacle. The key points to remember are that friction is critical for removing germs, and the friction should be applied for at least 15 seconds. Always keep your fingers pointed down and turn off the water with a paper towel. Your correct use of disposable non-sterile gloves helps prevent the spread of infection and protects both you, the caregiver, and the person receiving care, your patient. The gloves used most often are made of latex, are powder-free, and are easy to put on and take off. They are used once only and then discarded. Gloves are not worn all the time in giving care. Touching your patient with bare hands shows love and respect, sends a message of caring and acceptance, and provides comfort. Gloves should always be worn if contact is likely to occur with blood, body fluids, excretions such as urine or feces, mucous membranes such as in the mouth or genitalia, or non-intact skin. Before you put gloves on, carefully wash and dry your hands. Pull a glove out of the box with one hand and slide it onto your other hand. With your gloved hand, pull another glove out of the box and slide it onto your bare hand. Interlace your fingers to make the gloves fit more smoothly and comfortably. You should remove your gloves immediately when the patient care procedure is complete, if the gloves are heavily soiled, if a glove is torn, after you have touched your patient's secretions or excretions, before touching another part of the body, before touching any clean surface or object. When you remove your gloves, your intent is to avoid touching the contaminated surfaces of the gloves with your bare hands. To take off your gloves, firmly grip one glove at the base of the palm and pull it off inside out. Keep holding it in the palm of your gloved hand. Slip your bare fingers under the wrist of the remaining glove without touching its surface. Push the glove down and off with the first glove tucked inside of it. One glove is now inside the other and both are inside out. Drop the bundle of gloves into a sealable plastic storage bag and seal it tightly. Drop the sealed bag into the trash. Carefully wash and dry your hands. The equipment you will need to assemble includes 2 pairs of clean disposable gloves, cleansing solution, small gauze pads for cleaning, large gauze pads for dressing the wound, adhesive tape, a large sealable plastic bag. Carefully wash and dry your hands. Put on your gloves. The first step is to remove the old dressing. Loosen the edges of the tape and peel the tapes off the skin by pulling them towards the wound, keeping the skin taut with the other hand. Lift the tapes and the dressing off together. Note any odor or color of any drainage on the dressing. Discard the dressing and tapes into the plastic bag. If the dressing sticks to the wound, pour a little cleansing solution onto the dressing and let it sit for a minute. Gently pull the dressing off, keeping the skin taut above the wound. Look carefully at the wound. Any of the following should be reported immediately to your doctor or nurse: redness of the wound or surrounding skin, drainage from the wound, particularly if it's yellow and smells, any bleeding, swelling of the skin around the wound, separation of the edges of the sutured wound, or maceration, a waterlogged appearance of the edges of the wound. Pour some cleansing solution onto a small gauze pad. Squeeze out the surplus solution and with one stroke, clean the wound from top to bottom. Discard the gauze pad into the plastic bag. Using a fresh gauze pad with cleansing solution for each stroke, work away from the wound to clean the skin for about 3 inches from the wound on either side. Stroke from top to bottom and discard each gauze pad into the plastic bag. Remove your gloves and discard them into the plastic bag. Wash and dry your hands. Open the package with the large gauze dressing. Put on clean gloves. Pick up the gauze dressing, holding it only at 2 diagonally opposite corners. Center the gauze pad over the wound and place it on the wound. Tape the dressing securely in place. Remove your gloves and discard them into the plastic bag. Seal the bag securely and discard it into the trash. Wash and dry your hands. If your skin is sensitive to the adhesive on the tape, hypoallergenic tape can be bought at your surgical supply store, or bandages or binders can be used to hold the dressing in place. Consult with your doctor or nurse. Sometimes after surgery, your patient may need help with feeding. Before serving the food, make the environment as attractive as possible. Complete any toileting needs your patient has. Help your patient wash his hands. Make sure the patient has any dentures, glasses, or hearing aids that are used. If your patient is able to get out of bed, help him sit at the table in a straight back chair so that the tabletop is at a comfortable height and distance so that he does not have to stretch to eat. Before serving the food, wash and dry your hands. Display the food conveniently and attractively and describe it to your patient. If your patient is staying in bed, use pillows so that the patient is comfortably upright. If you are using an overbed table, remove any objects on it and wipe it with a damp paper towel. Before serving the food, wash and dry your hands. Use a towel or a bib to protect clothing and bed covers. Place a tray with the food on the overbed table and describe the food. Prepare any food such as opening and pouring containers of fluids, buttering bread, using condiments, cutting food. Sit at the patient's side, at or below eye level. If you're right-handed, sit at the patient's right side so that your patient does not have to keep his head turned towards you. Use a fork half full of solid food or a spoon half full of liquid. Always encourage your patient to feed himself as much as possible. Liquids should be given frequently, either with a spoon or a straw. Use a napkin or paper towel to wipe your patient's mouth if needed. When a patient has finished, remove the tray and help him to wash his hands and face and brush his teeth. If need be, help him with toileting. Wash and dry your hands. This program provides you with tips to help you get out of bed after abdominal or chest surgery. For the first few days when you come home after surgery, it's always best to have a family member or friend help you to get out of bed. Do not get out of bed directly from lying flat. Always sit up in bed for a few minutes. Move the bed covers well out of the way. Move nearer to the side of the bed. Pivot your body and legs so that you are sitting with your legs dangling over the side of the bed. Hold the mattress with your hands for support and keep your back straight. Gently swing your legs back and forth. Bend and stretch your ankles and twiddle your toes. If you feel faint or weak, go back to bed. Have your helper put on your socks and shoes or sturdy slippers with low heels and non-slip soles. Use a footstool if the bed is too high for your feet to reach the floor without sliding off the bed. Stand still on the floor with your feet slightly apart for a few seconds. Have your helper put on and fasten your robe. For the first few times out of bed, when you feel strong enough, walk a few steps to a bedside chair with arms. When you reach the chair, turn around so that your calves are touching the front of the chair. Bend your knees, grasp both arms of the chair firmly, and lower yourself backward into the chair. Reverse the process to get out of the chair. At any time, if you feel weak or dizzy or have chest pain, let your helper get you back to bed and inform your doctor. Some additional tips for the helper to follow. Make sure your own footwear has non-slip soles. Remove any hazards from the floor, such as slip rugs, frayed carpet or linoleum, or electrical cords. Stand at the side of your patient, not directly in front. Avoid lifting your patient under the arms. This can cause pain or dislocation of the shoulder joint. Never let your patient put arms around your neck. The key to safely helping a frail or weak patient out of bed is to use a transfer belt. This is a heavy canvas belt, 2 to 3 inches wide. It can be purchased at your surgical supply store. Use of the transfer belt provides safety for you and your patient, provides a feeling of comfort for your patient, gives you control if the patient starts to slip or fall, and prevents injury to you or your patient. A regular leather or material belt should not be used as a substitute for a transfer belt. Do not use a transfer belt if your patient has had recent abdominal surgery, has a colostomy, or a gastostomy with a feeding tube going directly into the stomach, has severe cardiac or respiratory disease, or has fractured ribs. If your patient has been lying flat, always sit the patient up for a few minutes before moving him out of bed. Move the bed covers well out of the way. Bring the patient nearest to the side of the bed and help the patient pivot so that he is sitting with legs dangling over the side of the bed. Let the patient sit for a minute. If the patient feels weak or faint, help him back to bed. Help the patient put on a robe, socks and shoes, or sturdy slippers with low heels and non-slip soles. Place the transfer belt around the patient's waist with a buckle in front. The belt is always applied over clothes and must never touch the patient's skin. Thread the belt through the buckle, teeth side first, pull it snug, and thread the belt back through the buckle for security. Tuck the loose end in the belt. The belt should be snug, with enough space between the belt and the robe for your fingers side by side. Have the patient place both feet on the floor, or footstool if necessary, about 12 inches apart, and both hands palm down on the mattress at his side. Place one of your legs between the patient's legs and slightly bend your knees. Grasp the transfer belt from underneath with one hand on either side several inches away from the buckle. Have the patient lean forward and, on the count of 3, push off the bed with his feet and hands to stand up. You use the belt as a support and do not pull the patient up with it. Allow the patient to stand still until he is comfortable. If the patient is weak or faint, help the patient back to bed. You stand to the side and slightly behind the patient. With one hand, hold the belt. With an underhand, grasp at the back of the patient. Support the patient in the same way as he walks to a nearby chair or commode, both of which have arms. When the patient reaches the chair, use an underhand grasp on the belt from the front with one hand on each side of the buckle. Have the patient pivot until his calves touch the front of the chair. The patient then bends his knees, grasps the arm of the chair with both hands, and slowly sits down as you support him. The procedure is reversed to have the patient get back to bed. Always encourage the patient to do the work and be independent, and remember to use the belt as a support tool and not as a pulling device. If the patient starts to fall, grasp the belt with both hands at the back of the patient, a foot apart. Pull the patient close to your body and slide him down your body to the floor. Bend your knees as you do this. Support and lower the patient's head once his body is on the floor. The supplies you will need to have easily accessible in the bathroom include clean clothing, skid-proof plastic bath mat, 2 washcloths, 2 towels, soap, shampoo, plastic pitcher, skin lotion, comb and brush, disposable gloves, and a sealable plastic storage bag. Ensure that the bathroom is pleasantly warm, around 70 degrees. Place the skid-proof plastic bath mat in the tub and fill 1/3 of the tub with warm water. Test the temperature of the water with your hand. Wash and carefully dry your hands. Put on your disposable gloves. Help your patient undress and place soiled clothing in the plastic bag in the laundry hamper. Help your patient sit on the edge of the tub. If there's a grab bar on the back wall of the tub, have the patient hold it with one hand. Swivel and lift both legs into the tub. From the back, support your patient under both arms and help him slowly lower his body into the water. Encourage your patient's independence and have him do as much of the washing as possible. You may need to assist in such areas as the patient's back, and to rinse off all soap with the shower extension or a pitcher. If it's shampoo time and the patient cannot do it himself, You can have him hold a dry, folded washcloth over his eyes to protect them. Pour clean, warm water over the patient's head using a pitcher or shower extension. Rub in shampoo and massage the patient's head. Rinse off the shampoo with clean, warm water using a pitcher or a shower extension. Dry the hair. If possible, have the patient stand and help him dry his upper body. Otherwise, dry his upper body and arms with him sitting in the tub. Let the water out of the tub. With a towel over his upper body, help the patient sit on the edge of the tub. Support the patient and help him swivel his legs over the edge of the tub. He can rest for a while if need be. Help dry the rest of the body, paying attention to under the arms, other skin creases, and in between the toes. Apply body lotion to the skin and help the patient dress. After making your patient comfortable, return to the bathroom. Place soiled towels and washcloths in the laundry bag. Clean the tub and mop the floor. Remove your gloves, discard them into the plastic storage bag. Seal the bag and place it in the trash. Carefully wash and dry your hands. The supplies you will need to have easily accessible in the bathroom include clean clothing, skid-proof plastic bath mat, 2 washcloths, 2 towels, soap, shampoo, plastic pitcher, skin lotion, comb and brush, disposable gloves, and a sealable plastic storage bag. Ensure that the bathroom is pleasantly warm, around 70 degrees. Place the skid-proof plastic bath mat in the tub and fill 1/3 of the tub with warm water. Test the temperature of the water with your hand. Wash and carefully dry your hands. Put on your disposable gloves. Help your patient undress and place soiled clothing in the plastic bag in the laundry hamper. If your patient is not strong enough to get into the tub or stand upright long enough to take a shower, you can use a bath stool or a bath seat across the tub. Help your patient sit on the edge of the tub. If there's a grab bar on the back wall of the tub, have the patient hold it with one hand. Swivel and lift both legs into the tub. With the patient seated, it's easiest and most comfortable for the patient to use a shower extension. Again, encourage the patient to do as much as possible for himself. You may have to help with the back and to make sure all soap is rinsed off the skin. If If it's shampoo time and the patient cannot do it himself, you can have him hold a dry, folded washcloth over his eyes to protect them. Pour clean, warm water over the patient's head using a pitcher or shower extension. Rub in shampoo and massage the patient's head. Rinse off the shampoo with clean, warm water using a pitcher or a shower extension. Dry the hair. If possible, have the patient stand and help him dry his upper body. Otherwise, dry his upper body and arms with him sitting in the tub. Let the water out of the tub. With a towel over his upper body, help the patient sit on the edge of the tub. Support the patient and help him swivel his legs over the edge of the tub. He can rest for a while if need be. Help dry the rest of the body, paying attention to under the arms, other skin creases, and in between the toes. Apply body lotion to the skin and help the patient dress. After making your patient comfortable, return to the bathroom. Place soiled towels and washcloths in the laundry bag. Clean the tub and mop the floor. Remove your gloves, discard them into the plastic storage bag. Seal the bag and place it in the trash. Carefully wash and dry your hands. If you have a walk-in shower and the patient's strong enough to stand for a shower, the helper may need to stay with him and generally help with the procedure.